First case.
It's the first case in the
The
country.
confirmed case arrived in the Philippines from Wuhan, China.
First death.
The Philippines reporting the first coronavirus death.
April 4, 2020. The start of quarantine in the whole Davao region.
Mupatuman enhanced community quarantine ang Davao City Government sugod Abril 4.
People were advised to stay at home, wear their mask, and wash their hands. However, not long after the quarantine was implemented, news about hospitals beginning to reach their full capacity started to circulate. How will these hospitals manage the continuing arrival of COVID-19 patients? What will they do the moment patients can no longer be accommodated inside their facilities? And most importantly, how will these healthcare institutions carry on providing their possible patients' needs? Adrian K.T. Kamid, a first-year college student in Ateneo de Davao University, experienced the shortage of hospital facilities in the said city. And Lorly C. Tampipi, a mother of a 1-year-old child in Davao del Norte, also experienced one of the struggles of hospital facilities shortage rejection. These people encountered, as well as witnessed, the current issue of healthcare facilities and equipment shortages at the hospitals within Metro Davao, and are willing to recall and share what they have undergone during those events.
It was 9 in the evening. I was rushed to the hospital due to the sudden pain I felt in my shoulder. In other parts of my body, heart was pounding and I had difficulty in breathing. So when we arrived at the hospital, they just put me outside of the emergency room. And I found out that there was no bed or room left for me. So they put me in their isolation tent. And there they laid me down to their extra hospital bed. I felt uncomfortable staying there, but I don't have a choice because they had a lack of room facilities. So the scarcity, as I observed, it's too severe. I had a lot of patients to accommodate.
We were in that hospital that day because during that day, her fever was on and off. So we decided to rush her to the hospital because at 4 o'clock in the afternoon, it reaches 49. So we were so worried about it, so we decided to bring her to the hospital. We were not accommodated well. We were not treated as patients in need. Talking about scarcity, I would say it's about the equipment, it's about the facility, because it's a private hospital. So the lacking one is when it comes to service.
Because of the desperate need for medical equipments and facilities in the hospital of Metro Davao, local citizens, medical personnel, local government officials wasted no time and decided to improvise in order to provide.
From recycling abandoned hospital equipment, transforming public gymnasiums into COVID isolation facilities, using plastic containers as face shields, to our frontliners wearing garbage bags as one of their personal protective equipment. No one wasted a single opportunity to provide and cover what lacks. Non-government organizations like Aboides Group initiated in donating tents as additional COVID facilities for hospitals experiencing shortages such as Southern Philippines Medical Center. Local fashion designers Pati Ang, Yong Davalos, Rajo Laurel, Santi Obsena, Doms Ramos, Michael Leva, and Boy Quinones worked hand in hand and also contributing in helping our frontliners by sewing personal protective equipment for them.
Our government, the hospitals, healthcare workers, NGOs, and even entrepreneurs, they all have done their part in aiding the shortages our healthcare facilities face. Now, it is time for us, as an ordinary citizen, to do our part as well. Wear your mask, adhere to social distancing, wash your hands, get vaccinated, and stay at home. Let us all help one another because we are all in here together. I am Anne Lawrence Amrana, an advocate for the SDG9 industry, innovation, and infrastructure. And this is Kulang.